Good afternoon, everyone. I'm calling to order this joint hearing between the House Committee on Consumer Protection and Commerce and the Committee on Legislative Management. It is Thursday, April 13th, 2023, 2 p.m. We are in conference room 329. We will be limiting testimony 2 minutes. For those who are testifying via Zoom, please keep yourselves muted and your videos off until it is your turn to testify. If you are having technical issues, you can use the chat function to get that cleared up. Okay, first on the agenda, we have SCR 4 SD1 requesting the auditor to conduct a sunrise review of the regulation and licensure of associate physicians. First to testify on this measure, we have the State Auditor Leslie Kondo from the Office of the Auditor with comments. Oh, I guess they're not here. Anyone from the Hawaii Medical Board here? Okay, please go ahead.
I'm James Kizuski, a fellow executive officer. The medical board's currently meeting right now, so she asked me to be here and stand under testimony and take any questions that you guys may have back to her.
Thank you. Are there any other persons here to testify on this measure? Okay, seeing none, members, are there any questions? Actually, I do have a question for the medical board. So in the auditor's testimony, they noted that the profession of associate physician is currently regulated under Hawaii revised statutes. Is the board not in concurrence with that assessment?
Okay, I'm gonna have to take that one back.
Okay,
I'm
sure.
not prepared to answer that question. But thank you, Representative, and I'll make sure that she reaches out with an answer.
Okay, thank you so much. No further questions. Okay, members, any further questions?
I have a question.
Please go ahead.
No, that's okay.
Okay. Okay, seeing none, we'll be moving on to the next item, SCR 15, SD1, requesting the auditor to assess both the social and financial effects of proposed mandated health insurance coverage for a percentage of the cost of ketamine therapy to treat depression. First to testify on this measure, we have Thomas Cook, MD, from Beyond Mental Health, in support on Zoom.
Yes, hi there. Can you hear me?
Yes, please go ahead.
Okay, just making sure I have video. I'm Dr. Thomas Cook, and I spoke initially with Senator Favela to draft this measure. He had a family friend who died from suicide and couldn't afford ketamine, and he came into my office and talked to me about it. And I shared with him some of the stats, and that's that ketamine is the only antidepressant treatment that we have that reduces suicidal thoughts. And so currently we're in a strange place where patients come to me suicidal and depressed, and I have a busy private practice in town here, and I treat treatment-resistant patients who have failed Prozac and other meds. And the ketamine can likely save their life, but the insurance won't pay for it. So any claims that we submit to HMSA or UHA get routinely denied, probably largely just because there's not a lot of precedent for it. It's a new area. And they already cover Spravato, which is a nasal spray version, but which does released by Johnson & Johnson. It's FDA approved. But that treatment does not reduce suicidal thoughts at all. And so I really think out of social equity, we really need to have this treatment not limited to those that can afford to pay out of pocket. And I really feel that this treatment can be easily regulated by the insurances to ensure that only a board certified psychiatrist is in the clinic and not Payne and other doctors trying to start these ketamine businesses, which have popped up all over the US. And I think that would be, helpful to Hawaii and the mental health, and also deal with the rising incidence of suicide here. So that I'm available for questions if you have any.
Thank you. Next, we have Robin Martin from the Kahala Clinic for Children and Family, in support on Zoom.
Hi, everybody. Aloha, Chair, Vice Chair, members of the committee. My name is Dr. Robin Martin. I'm a board-certified psychiatrist. I trained here in Honolulu. I'm assistant clinical faculty with the UH and also with the Kahala Clinic for Children and Family. I'm in strong support of this bill. In my profession, I'm on the front lines of addressing the mental health crisis, but you do not have to look far to appreciate the unmet need for new treatments. Major depression is becoming the leading cause of disability worldwide. Suicide is currently the leading cause of death in the youth of Hawaii. standard treatments, including medications and psychotherapy, are not effective for at least 1/3 of patients. Many others have significant side effects that prevent adequate treatment. We really need our therapy, and ketamine's been the only thing that has worked for them. However, some patients do require maintenance treatment, and it can be financially burdensome for many families. So I think this bill is an important step forward in making this treatment more available to the people in Hawaii who need it the most. Thank you very much. I'm available for any questions.
Thank you. Next, we have Kevin Martin, individual, testifying in support. Okay, not here. Okay, members, we have written testimony with comments from the Office of the Auditor. Are there any other persons here to testify on this measure? Seeing none-
Chair?
Oh, pharmacists. First to testify on this measure, we have James Skizowski, Executive Officer from the Board of Pharmacy, in support.
Thank you, Chair. I'll stand on our written testimony.
Thank you. Next, we have Corey Sanders from the Hawaii Pharmacists Association in support on Zoom.
Thank you, Chair, Vice Chair, and members of the committee. We'll stand in strong support on our testimony, and I'm happy to answer any questions you all have.
Thank you. Next, we have Dawn Kurisu from the Hawaii Medical Services Association in support. Thank you. Members, we have numerous testimonies in support and a written testimony with comments from the Office of the Auditor. Are there any other persons here to testify on this measure? Seeing none, members, are there any questions? Okay, seeing none, we'll be moving on to the next item in the agenda, SCR 18 SD1, requesting the auditor to conduct a social and financial assessment of the proposed mandatory health insurance coverage for various sexual and reproductive health care services. First to testify on this measure, we have Michael Goliuk Jr. From the Stonewall Caucus of the Democratic Party of Hawaii in support on Zoom.
Good afternoon again. Yes, Michael Goy, Jr., Chair of the Stonewall Caucus. We stand in strong support of this. We stand that it's definitely something we need to get done to help everybody. So we encourage you to pass this resolution just so we can get this audit done. Mahalo.
Thank you. Next, we have Dawn Kurisu from HMSA in support. Thank you. Members, we also have written testimony in support from the Planned Parenthood Alliance. Are there any other persons here to testify on this measure? Okay, seeing none, members, are there any questions? Seeing none, we'll be moving on to the last item on the agenda, SCR 202 SD1, requesting the auditor to conduct a social and financial assessment of the mandating parity in vitro fertilization health insurance coverage. First to testify on this measure, we have Dawn Kurisu from HMSA with comments. Thank you. Next, we have Michael Goliuk Jr. from the Stonewall Caucus of the Democratic Party of Hawaii in support on Zoom.
Good afternoon once again. The Stonewall Caucus stands in strong support of this audit. We've been trying to get parity and equality for LGBTQIA couples when it comes to IVF coverage for years. So the only way that we now believe that we're going to be able to get to that is actually by doing this study and doing the Sunrise audit and making sure that they do get the coverage. Our couples do get the coverage that they definitely deserve, since they are paying the same amount as a heterosexual couple for their insurance coverage. Mahalo.
Thank you. Members, we have written testimony in support from Rainbow Family 808 and an individual. Are there any other persons here to testify on this measure? Seeing none, members, are there any questions? Okay, seeing none, we'll be taking a short recess for decision making. Recess. Good afternoon. We'll be reconvening this joint hearing between the House Committee on Consumer Protection and Commerce and the Committee on Legislative Management for decision making. First, we have SCR 4 SD1. We'll be making some amendments to this measure. There's some, I think, more debate about how to regulate, or if associate physicians are currently regulated under the current Hawaii revised statutes. So we'll be amending this measure to request the Legislative Reference Bureau to conduct an analysis of the regulation and licensure for associate physicians in Hawaii. And we'll be amending the resolution to incorporate this language appropriately. Members, are there any discussions? Okay, seeing none, Chair for the vote on SCR with amendments.
SCR 4 SD1 passed with amendments. Chair and Vice Chair vote aye. Representative Amato.
Aye.
Representative Beladi. Excuse. Representative Hashem.
Here.
Yes? Yes, thank you. Representative Hussey Burdick. Excuse. Representative Gates. Excuse. Representative Lowen. Excuse. Representative Onishi.
Aye.
Representative Tam.
Aye.
Representative Perrick.
Aye.
Okay, Chair, motion is adopted.
Thank you.
Same recommendation for the Committee on Legislative Management. Are there any questions, concerns, comments? Okay, let's take the vote.
Okay, voting on SCR 4 SD1, recommendation to pass with amendments. Chair and Vice Chair vote aye. Rep. Ilagan.
Aye.
Rep. Kitagawa.
Aye.
Rep. Matsumoto.
Aye.
It's adopted, thank you.
Thank you.
Thank you, members. Next, we are voting on SCR 15 SD1. I'd like to recommend that we pass this measure as is. Members, are there any discussions? Okay, seeing none, Chair for the vote on SCR 15 as is.
SCR 15 SD1. Chair recommends to pass unamended. Chair and Vice Chair vote aye. Representative Amato.
Aye.
Representative Beladi. Excuse. Representative Hashem.
Aye.
Representative Hussey Burdick is excused. Representative Gates. Excused. Representative Lowen. Excused. Representative Onishi.
Aye.
Representative Tam.
Aye.
Representative Perrick.
Aye.
Chair, motion is adopted.
Thank you.
Thank you. Same recommendation to pass SCR 15 SD1 as is.
Okay, comments? No.
Any comments? Okay, let's take the vote.
Okay, we're voting on SCR 15 SD1, recommendation to pass as is, noting all members present. Any reservations, any no's? It's adopted, thank you.
Thank you. Moving on to SCR 17 SD1. Members, I'd like to make an amendment to this measure, replacing a reference to SB 693 with SB 165, which contains the necessary language to conduct a analysis for a mandatory health insurance coverage. Okay, members, are there any discussion? Seeing none, Chair for the vote on SCR 17 SD1 with amendments.
SCR 17 SD1 as amended. Chair and Vice Chair vote aye, knowing the excused absences of Representative Beladi, Gates, Lowen, and Lowen. Are there any no's? Any reservations? Chair, motion is adopted.
Same recommendation. Thank you, Vice Chair, for that amendment. And are there any concerns, comments? Okay, let's take the vote.
Thank you. We're voting on SCR 17 SD1, pass with amendments, noting all members present. Are there any reservations? Any no's? It's adopted.
Thank you, members. Moving on, we are voting on SCR 18 SD1. My recommendation is that we eliminate the references to HB 1180 and maintain the focus on HB 1179 as the House Concurrent Resolution looks at 1180 separately. Okay, members, are there any discussions? Seeing none, Chair for the vote on SCR 18 SD1 with amendments.
SCR 18 SD1 as amended, knowing the excused absences of Representative Al-Baladi, Gates, and Lowen. Are there any no's?
No.
Representative Perrick? Any other? Oh, I'm sorry. Sorry, and also noting the excused absence of Representative Hussey Burdick. Any reservations? Okay, Chair, motion is adopted.
Thank you.
Same recommendation. Thank you again, Vice Chair, for that clarifying amendment. Are there any concerns, comments?
Okay, thank you. We're voting on SCR 18 SD1. Recommendation to pass with amendments, noting all members present. Are there any reservations? Thank you. Rep Matsumoto, reservations. Any noes? Okay, it's adopted. Thank you.
Thank you. Finally, we are voting on SCR 202 SD1. Chair's recommendation is to pass this through as is. Members, any discussions? Okay, Chair for the vote on SCR 202 SD1 as is.
SCR 202 SD1 unamended, knowing the excused absences of Representative Bellotti, Gates, Hussey Burdick, Gates, and Lowen. Are there any reservations? Any noes? No. Representative Herrick, no. Chair, motion is adopted.
Thank you.
SCR 202 SD1, same recommendation to pass as is. Any comments? Seeing none, let's take the vote.
Okay, thank you. We're voting on SCR 202 SD1. Recommendation to pass as is, noting all members present. Are there any reservations? Thank you, Rep Matsumoto. Reservations. Any noes? Okay, your measure's adopted.
Thank you. This joint hearing is adjourned. Good afternoon, everyone. I am calling to order the House Committee on Consumer Protection and Commerce. It is Thursday, April 13th, 2023. The time is, 2:22 p.m. We are in conference room 329. We will be limiting testimony to 2 minutes. For those who are testifying via Zoom, please keep yourselves muted and your video off until it is your turn to testify. If you are having issues with the Zoom function, please use the chat to contact our IT staff to get that sorted out. Okay, first on the agenda, we have SCR 28, designating the month of March as Hawaii Kidney Awareness Month. First to testify on this measure, we have Jace Mikulonic from the Queens Health System in support.
Chair, will stand on testimony and strong support from all.
Thank you. Members, we have written testimony and support from the Department of Health, Chronic Disease Coalition, U.S. Renal Care, Healthcare Associations of Hawaii, Hawaii Medical Associations, Hawaii Pacific Health, and 2 individuals also in support. Are there any other persons here to testify on this measure? Seeing none, members, are there any questions? Seeing none, we'll be moving on to SCR 48 SD1, requesting that the Department of Commerce and Consumer Affairs compile pertinent data to determine the appropriate scope of study, analyzing whether implementation in the state of laws similar to captive insurance laws of Massachusetts would address this state's residential condominium property insurance needs. First to testify on this measure, we have Nadine Ando, a director nominee for DCCA in support.
Hi, good afternoon, Chair, Vice Chair, members of the committee. I'm Nadine Ando here on behalf of the Department of Commerce and Consumer Affairs. And we submitted written testimony in support of this measure, and I'm available for any questions, which we will stand on, and available for any questions you may have.
Thank you. Next, we have Jeff Sedino, individual with comments on Zoom.
Yes, good afternoon, Chair, Vice Chair, and members of the committee. My name is Jeff Sedino, and I'm offering comments. I think this resolution is trying to fix the symptom instead of fixing the problem. The problem is that we currently have a virtually useless dispute resolution system, and this is what results in expensive litigation and the increase in insurance premiums that this resolution is trying to solve. For example, this year, my insurance premium went up by over 90%, 90, almost 100. Last year, my association concluded 2 lawsuits, neither of which resulted in a ruling in their favor. I believe that our insurance premium went up this year, not because of some fire safety law that was introduced several years ago, but because of the 2 lawsuits that were concluded last year. While I support the intention of helping condo owners with their rise in insurance premiums, I think we could get a much better return on our time investment if the committee would investigate and reform the dispute resolution system. Thank you for the opportunity to provide testimony.
Thank you. Members, we have written testimony with comments from individual and Hui Oiayo, and 4 testimonies in support from individuals. Are there any other persons here to testify on this measure? Seeing none, members, are there any questions? Seeing none, we'll be moving on to SCR 91 SD1, requesting the governor to convene a task force to examine and make recommendations on the existing procedures for the adoption of the state building code. First to testify on this measure, we have Tim Lyons, Subcontractors Association of Hawaii, in support. Are they here? Okay, seeing that they're not here, we'll be moving on to Jess Liorna from BIA Hawaii in support. Okay, thank you. Members, we have written testimony in support from RMA Sales, Hawaii Gas, DR Horton Hawaii Division, Engineered Systems Inc., Hawaii Pacific Homes and Appliance Distribution, Allen Plumbing Inc., and an individual, and we have written testimony with comments from IBEW Local 1186. Are there any other persons here to testify on this measure? Okay, seeing none, members, are there any questions? Okay, seeing none, we'll be moving on to SCR 124, urging the Real Estate Commission to develop policies and programs to inform and educate condominium association owners and board members of certain matters to promote the efficient administration of condominium associations. First to testify on this measure, we have Keaton Kleinhans, chairpersons for the Real Estate Commission, in support. Thank you. Next, we have Jeff Sedino, individual, in support on Zoom.
Yes, good afternoon again, Chair, Vice Chair, and members of the committee. My name is Jeff Sedino. I'm a condo owner. I support this resolution. All too often, a board member is just a volunteer and not educated about the rules and laws that they are required to follow. The problem is that because of this, they outsource their responsibilities to their managing agent to make sure that the rules and laws are being followed. Unfortunately, the managing agents are just as reckless at following the laws. For example, over the past week, Civil Beat has published 2 articles about Associa, the 2nd largest managing agent in the state, which shows that since January 1st, Associa has been operating as a real estate broker without an active license. This was confirmed by the DCCA. Making sure that you are licensed as a real estate broker should be the #1 rule and law that needs to be followed. An associate has been breaking that law every single day this year, despite doing hundreds or possibly thousands of unlicensed real estate transactions in that time period. Board members cannot rely on managing agents to help them follow the rules and laws. Board members should be educated so that they know how to follow the rules and laws themselves. Please pass this resolution to encourage board members to be educated. Thank you for the opportunity to testify.
Thank you, members. We have one written testimony in support from an individual. Are there any other persons here to testify on this measure? Seeing none, members, are there any questions? Okay, seeing none, we'll be moving on to SCR 131 SD1, requesting the Regulated and Industries Complaints Office to report the itemized total amount of fines or judgments collected and uncollected each year from 1983 to present, and to include that information in the Director of Commerce and Consumer Affairs' Annual Compliance Resolution Fund report. First to testify on this measure, we have Esther Brown from Complaints Enforcement Officer, Regulated Industries Compliance Office, with comments.
Good afternoon, Chair, Vice Chair, members of the committee. I'm Esther Brown here on behalf of RICO. I will stand on my written testimony offering comments. I've also proposed a friendly amendment to the resolution, which would limit the look-back period to just 5 years as opposed to 40, and also limit the scope of what's being asked for to just a summary of fines collected versus fines that are uncollected. And the reason for the friendly amendment is because our records are in hybrid format, and if we had to go back potentially 40 years, honestly, I don't know what those records look like, if they even exist. And so we want to shorten the time period and shorten the information being requested from an itemization to just a summary so that we can give to the legislature accurate information. It's much easier for my staff to work within those parameters. Thank you.
Thank you. Okay, that's all we have for testimony. Are there any other persons here to testify on this measure? Okay, seeing none, members, are there any questions? Actually, I do have a question for Rico. Okay, as you noted in your testimony and your oral testimony, it's pretty difficult to get those itemized records from way back in 1983. I'm just curious, how difficult would it be to include an itemized report of these expenses in future reports going forward?
We could we can certainly look at that. Definitely. We do have a new complaints management system. It's about 2 years old right now, so we're still kind of working things out. But yeah, going forward, I mean, we can certainly talk to our developer and see what we can do. If it's, you know, definitely work with you guys going forward.
Sounds good. Thank you so much. Okay, members, any further questions? Okay, seeing none, we'll be moving on to SCR 147 SD1, requesting the Public Utilities Commission to revise current rate structures and provide additional benefits for those communities that host renewable energy projects. First to testify on this measure, we have Dean Nishina, Acting Executive Director from DCCA Division of Consumer Advocacy, with comments.
Aloha and good afternoon, Chair, Vice Chair, members of the committee. Dean Nishina with the Division Consumer Advocacy, standing on standing on our written testimony, offering comments, available for questions if you have any. Thank you.
Thank you. Next, we have Leo Sunshin, Chair for the Hawaii Public Utilities Commission, with comments.
Good afternoon, Chair, Vice Chair, members of the committee. My name is Grace Ralph with the Public Utilities Commission. We'll stand on our written testimony, but can be available for questions. Thank you.
Thank you. Members, we have written testimony with comments from the from Hawaiian Electric. Are there any other persons here to testify on this measure? Okay, seeing none, members, are there any questions? Seeing none, we'll be moving on to SCR 183 SD1, requesting the Department of Human Services to study providing certain health insurance coverage for all children and pregnant persons who would otherwise qualify for coverage if not for their immigration status. First to testify on this measure, actually, members, we have written testimony with comments from the Department of Human Services and support from Hawaii Children's Action Network Speaks and an individual, and we have one individual in opposition. Are there any other persons here to testify on this measure? Okay, seeing none, we'll be moving.
Aloha.
Oh.
Sorry, aloha, Vice Chair. This is Liza Rangel with Hawaii Coalition for Immigrant Rights. We're just going to stand on our testimony in strong support of this. It's a very small population, but for that small population, it can mean the difference between being able to treat cancer or not. So we stand in strong support and hope we can move this forward next session. Appreciate it.
Okay, thank you so much. Are there any other persons here to testify on this measure? Okay, hearing none, we'll be moving on. Oh, yes, of course. Representative Burek for question.
Thank you. For the Hawaii Children's Action Network speaks, I have a question.
Boy.
The lady
I
that
don't
just
know.
talked.
Yeah, for the lady who was just on Zoom testifying.
Is that Michelle?
Liza with Hawaii Coalition for Immigrant Rights.
Oh, thank you. The question is this healthcare coverage for U.S. citizens?
So oftentimes I think, so there's something called PRU-Call, which is under the color of law. So folks that are working on their status but may not have achieved them yet because of backlogs or something, oftentimes are eligible to apply for insurance, but due to the stagnation of our immigration courts and the length of that process, they may not be able to achieve that at a time. So it's kind of a gray area. So folks are not citizens, but not just citizens are eligible for services. People who have green cards after 5 years are also eligible for services. And so this is really more about that gray period, people who are under PRU-Call.
Thank you.
Okay, members, any further questions? Okay, seeing none, we'll be moving on to SCR 188, urging the Department of Human Services MedQuest Division to advocate that the state increase Medicaid reimbursements to dentists and upon an increased approval to proactively inform both dental service providers and Medicaid beneficiaries of new rate plans. First to testify on this measure, we have Patrick Donnelly from the Hawaii Oral Health Coalition in support on Zoom.
Hi, good afternoon, Chair, Vice Chair, and members of the committee. I'm Patrick Donnelly. I'm the statewide Oral Health Coalition Manager for the Hawaii Public Health Institute. Mostly stand on our written testimony and support. Just wanted to add also that anecdotally, we know that this is consistently one of the most commonly cited issues that come up in terms of barriers to further engagement in Medicaid for dental providers. We do want to acknowledge DHS for their active investigation into this issue, and we thank them for that. We also thank the committee for your attention to this conversation also. Thank you for the opportunity.
Thank you. Next, we have Dr. Don Sand, individual in support.
Vice Chair Sayama, Chair Nakashima, and distinguished committee members. My name is Dr. Don Sand. For 8 years, I've been working as a frontline dentist and consultant in our safety net systems in Hawaii. Currently, I'm on 4 different organizations for oral health, 2 national best practices and 2 local, all focusing on oral health care disparity. We support SCR 188. We do want to just leave one highlight, though. If this is a chance to improve Medicaid across the board for the health of all of our Hawaiian citizens, we want to ask this committee to humbly recognize the tight, intimate correlation between oral health and whole body health. The disease goes both ways, from the mouth to the organs and back, making worse any diseases. And like in the same way, we'd humbly like to ask this committee recognize that our oral health financial systems are also correlated strongly with our state Medicaid systems and our medical financial systems. So one cannot be healthy with the other. Thank you so much for this chance to testify. Aloha.
Thank you. Members, we have written testimony and support from the Hawaii Dental Association and with comments from the Department of Human Services. Are there any other persons here to testify on this measure? Seeing none, members, are there any questions? Seeing none, we'll be taking a short recess for decision making. Recess. Good afternoon. I'm reconvening this committee. First, for the vote, we have SCR 28. Members, I'd like to pass this measure as is. Members, any discussion? Seeing none, Chair for the vote on SCR 28 as is.
SCR 28 unamended. Chair and Vice Chair vote aye. Representative Amato.
Aye.
Representative Bellotti is excused. Representative Hashem. Aye. Representative Hussey Burdick, excused. Representative Gates, excused. Representative Lowen, excused. Representative Onishi. Aye. Representative Tam.
Aye.
Representative Perrick.
Aye.
Chair, motion is adopted.
Thank you. Moving on, we're voting on SCR 48 SD1. Members, my recommendation is that we move this measure forward unamended. Members, are there any discussion? Seeing none, Chair for the vote on SCR 48 SD1 as is.
SCR 48, Senate Draft 1, unamended. Knowing the excused absences of Representative Bellotti, Hussey Burdick, excuse me, Gates, and Lowen. Are there any reservations? Any noes? Chair, motion is adopted.
Thank you. Moving on, voting on SCR 91 SD1. Members, I'd like to move this measure forward unamended. Any discussion? Seeing none, Chair for the vote on SCR 91 SD1 as is.
SCR 91 SD1, moving unamended. Knowing the excused absences of Representative Bellotti, Hussey Burdick, Gates, and Lowen. Are there any reservations? Any noes? Chair, motion is adopted.
Thank you. Next, we're voting on SCR 124. Members, I'd like to push this forward unamended. Members, any discussion? Seeing none, Chair for the vote on SCR 124 unamended.
SCR 124 passing unamended. Knowing the excused absence of Representative Bellotti, Hussey Burdick, Gates, and Lowen. Are there any reservations? Any noes? Chair, motion is adopted.
Thank you. Moving on to SCR 131 SD1. Members, I'd like to make an amendment to this concurrent resolution. I'd like to omit the phrase on page 2 from lines 25 to 26 from 1983 to present. And I'd like to also omit the verbiage on lines 29 through 32, making this reporting going forward, not necessarily back from 1983. Members, are there any discussions? Seeing none, Chair for the vote on SCR 131 SD1 amended.
SCR 131, Senate Draft 1, with amendments. Knowing the excused absences of Representative Bellotti, Hussey Burdick, Gates, and Lowen. Are there any reservations? Any noes? Chair, motion is adopted.
Thank you. Next, we will be voting on SCR 147 SD1. Members, I'd like to make an amendment to this concurrent resolution. On page 2, lines 8, I'd like to replace the word revise with evaluate. And on page 2, line 9, I'd like to replace the word provide with consider. Basically, this softens the language because I believe that if we are going to be mandating something to the PUC, we should be actually giving a little bit more specifics. Otherwise, I'd just like this to be a recommendation. Members, are there any discussion? Okay, seeing none, Chair for the vote on SCR 147 SD1 with amendments.
SCR 147 SD1 passed with amendments. Knowing the excused absence of Representative Bellotti, Hussey Burdick, Gates, and Lowen. Are there any reservations? Any noes? Motion is adopted.
Thank you. Voting on SCR 183 SD1, my recommendation is that we pass this resolution for an unamended. Members, are there any discussions? Representative Purick.
I'd like to thank the introducers of this bill. There's definitely heart and compassion when it comes to desiring to provide medical services to people who aren't residents, or I should say more specifically citizens of America. But I think our tax dollars should be allocated towards U.S. citizens and not people who aren't U.S. citizens yet. So I'll be voting no.
Thank you. Members, any further discussion?
I have something to say.
Representative Tam.
I'm going to support this bill because I don't think that we should be allowing, children and those that are pregnant just go sick without access to healthcare. I think that we degrade ourselves as a society if we do so. So then my faith would not allow me just to vote no on that.
Thank you. Members, any further discussion? Seeing none, we'll be voting on SCR 183 SD1 as is.
Okay, SCR 183, Senate Draft 1, moving unamended, knowing the excused absence of Representative Bellotti, Hussey Burdick, Gates, and Lauren, and the nay of Representative Pyrrhic. Are there any reservations? Any noes? Chair, motion is adopted.
Thank you. Finally, voting on SCR 188. Members, my recommendation is that we move this resolution forward unamended. Are there any discussions? Okay, seeing none, Chair for the vote on SCR 188 unamended.
SCR 188, moving unamended, knowing the excused absence of Representative Bellotti, Hussey Burdick, Gates, and Lowen. Are there any reservations? Any noes? Chair, motion is adopted.
Thank you, members. This hearing is adjourned.